Daniel Oklu and Anthony Jackson are the directors this morning for TV3 New Day. Shouts to you two gentlemen. You're doing a great job alongside Coco. Hi. Now, moving away from sports, let's talk about health and something that entails to women and children in this country. When you're talking about our healthcare delivery system, you cannot take away women and children out of it. Now, the Family Health Division of the Ghana Health Service in 2018 and 2019 had conferences that saw stakeholders coming together to review the situation of reproductive, child, adolescent health and nutrition in the country, and to devise appropriate strategies for implementation. Now, these two were very successful. The third one is upon us. So this morning, we just want to take a look at what has been achieved so far with these two conferences, what the loopholes and the gaps still, what they are in our healthcare system, what we can do, or what this conference is seeking to do, and then also looking at some of the activities that have been lined up for the third conference coming up in no time. So joining me this morning is Margareta Gloria Chandi. She is from the Ghana West Municipal Directorate of the Ghana Health Service. Now, she's going to be leading us in this discussion of this third conference that is underway in no time. Good morning, ma'am.
Good morning.
How are you doing?
Great.
Good to see you again. I saw you earlier this morning, but good to have you here this time. Now, tell me, when we talk about healthcare or our healthcare delivery system, especially in Ghana, there is no way that you can take away mothers and children. These two conferences, 2018 and 2019, I suppose that because of COVID, that's why we couldn't have the one in 2020. But this is the third one in 2021. Congratulations, first of all.
Thank you.
And tell us, what has been achieved so far?
So far, through this conference, we've been able to foster partnerships.
Okay.
And we've also been able to have a drive so that whatever the challenges, we'll be able to surmount it. Despite COVID, we've been able to at least achieve some targets.
Okay.
Like when it comes to newborn postnatal care.
Okay.
At least we're doing 94% now.
As at now?
As at now.
2020 or 2021?
As at 2020.
Okay.
We've achieved up to 94%. When it comes to skilled birth attendant, we are still having impact, but we've been able to achieve at least 65% of that, and then ANC 79%. For neonatal mortality, the decline has been slow, but at least we are at 7.2 now.
Okay.
We want to a target of at least 5, but we are at 7.2 now. Family planning, we are not doing too well, but there have been minimal gains.
I like the way you admitted that you haven't been doing too well.
Yeah.
Okay. But minimal gains there, you mentioned.
Yeah, so we are 29.5%. Yeah.
Well, in doing some research also, I was checking on exactly what the figures are for child mortality also. And then I realized that in 2020, the figure actually came down a little bit because we had 33.7 out of every 1,000 live births in 2020. Exactly. But in 2019, the figure was actually 34.668. So it means that you've made some inroads there as well. Congratulations to you. Thank you. In moving forward, what is this third conference seeking to achieve? You're doing well significantly with all the figures that you've churned out this morning. But what are you hoping to achieve with this third one?
Yeah, for this third one, we want to sustain these gains that we have made and want to foster more partnerships. We want to ensure that there's more synergy in what we do. And we are also ensuring that despite what happens, we will be able to focus on our targets.
Okay.
You realize that COVID-19 virtually
I was just
stopped
going to
everything.
ask how you people have survived and thrived even with the pandemic.
Yes, COVID-19 hit us hard. health workers went down. I mean, even facilities were full. But in all these, we were able to use different strategies to achieve our aim. So this conference is just about building more synergies, that's partnership, finding innovative ways where we can sustain these gains, and also look at new and emerging areas we could also tread.
Now, we know that the Ghana Health Service has embarked on numerous campaigns, and this particular one, maternal, child health and nutrition, why has it been so significant for you to hammer on that even this third one is taking place?
You know, the health of mothers and children are very, very vital.
Okay.
In every society, at least mothers form over 20% of the population. And mothers and children's needs are, it's like they are almost silent. So if a nation doesn't come out to look at these particular groups' needs, the healthcare system will go down, because one of the indicators to, make sure that social justice is going on in the country. That is why we are so particular about mothers and children.
Now, when it comes to the disparity in access to good quality healthcare, especially for mothers and children, is this conference going to address that as well?
Of
because
course.
there's a whole gap. It looks like the attention is not paid too much to them. We still see women who've delivered fresh babies and they are sleeping on the floor, hospital floors with these babies, and sometimes even in the hinterlands they don't even have access to good quality healthcare. Some pregnant women are still in our communities and they get delivered by just experts in their communities who are not even medical officers or anything. Does this conference seek to address this matter? Because it's very pressing in our communities.
Of course, and like you said, these issues are there, but we have strategies, like the checks and also home visiting. These are some of the strategies that address these challenges that you talk about. But you know, challenges upon challenges, even in rolling out these services, there are still challenges, and these are all parts of the reason why this conference is coming on.
Anyway, like I said in the beginning, congratulations on the first two. Now, let's take a look at this third one. Exactly when is it starting and how many days is it? Is it just a day's event?
No, it's not a day's event. It's 11th to 13th August.
Okay.
Yeah, and it will happen at Labadi Beach Hotel, but it's strictly by invitation.
If you're not invited,
you are not invited, you join via Zoom.
Oh. Okay, so is the Zoom ID out already, or is there a phone number? Or if we visit the Ghana Health Service site, can we get access to the Zoom ID?
The Zoom ID is not out yet, but by the time we get to the conference, it will be displayed at the Ghana Health Service website.
So it's from the 11th to the 13th of August. Is it in the morning, afternoon? What time is it?
It's going to be a whole day session.
Oh, it's a whole day. But what time do we start?
We'll start around 9:30.
Now 9:30 in the morning, and then proceedings will start. Any specific activities lined up for this third conference?
Yes, there will be group activities under sub-teams. For example, when it comes to maternal and child health, there will be specific objectives that will be followed. There will be plenary sessions to at least iron out issues. And there will be poster presentations. And of course, the people will also showcase what they have done in achieving the successes that we have.
Okay. And you say that this conference is strictly by invitation.
Strictly by invitation.
Okay, but if you're out there and you still want to participate, I've just been told that from the 11th to the 13th of August, when you're able to launch yourself onto the Ghana Health Service website, there'll be live streaming on the site also, so that you can watch. But
and even on Facebook page.
Oh, it will be on Facebook as well. So it will be on Facebook Live, the Ministry of Health page on Facebook. Okay, so that's the 11th to the 13th of August 2021 by 9 a.m. By 9 a.m. it starts, and then we take it from there. Okay, great. Now, is there anything else you want to add before we sign off this morning?
Yeah, you see, in rolling out our services, we have a few challenges. The nation has a challenge with anemia, especially anemia around the 36th week of pregnancy. The blood volume in the pregnant woman is so low that if we don't take care, it leads to maternal mortality and all its other complications. In order to solve this issue, we have a package called Girls Iron Folate Tablet Supplementation.
Say that again.
Girls Iron Folate Tablet Supplementation. That is gifts.
Okay.
And we give this to adolescents. You know, we need to enhance our preconception care. Before you get pregnant, your system must be built to handle the pregnancy. So these tablets are given to the teenagers or adolescents in the communities and in schools. But when we go out to give these tablets, we are perceived as giving the girls contraception. Nobody can give anybody contraception without the person's approval. These are iron tablets to help improve the health of the girls. So we are using your media to appeal to the public. You know, Ghana Health Service, our logo is an egg with two hands. The egg is the population, the people we are caring for. You because of other things that happen, you might not believe it, but you are the egg. Your life is so precious to us. So Ghana Health Service will not go out of its way to do something that will jeopardize your health.
But Margareta, let me just come in for a second. It's good that you prepare a woman's body to take pregnancy and all that, but you're giving or you're administering these pills that you're talking about, this medication, to adolescents. And you know we're in a country that is also struggling with teenage pregnancy. So if you make these women too fertile in this age bracket, are we not also promoting teenage pregnancy?
The tablet is not to make women fertile.
Okay.
The tablet is to build on the iron stores.
Right. Okay. So that's the clarification.
That's the clarification.
It doesn't make women fertile.
No. Okay. And it doesn't even cause contraception. No. The purpose is to build the iron stores.
But if you have a lot of iron in your body, I mean, it means that if you make a small mistake, I don't know.
No.
You don't think so?
No.
You don't think so?
No. No.
Why are you saying no? Have I scratched that uncomfortable surface for you?
Not at all.
No, but you've said no like a million times.
I don't know how to express myself.
I'm sitting and I'm thinking, I don't think that I'll allow my little sister who is 16, 17 or 18 to even live on those supplements to get, because just in case they have unprotected sex.
No, you see, you are only building on your iron stores. Before you'll be able to become pregnant, you must have adequate eggs.
Okay,
you understand?
But has the ministry looked at maybe increasing the age bracket instead of administering it to adolescents? Can it just go up a little bit?
That is where we can do the correction.
Okay. Oh, okay. I get it.
That is where we can do the correction. Before you mature, your bones must, be of... it should be able to hold the baby. So it's building on your iron stores. And iron is not the only supplement we need. You understand?
Right.
But when you lose blood, so that you don't, die easily.
Okay. So you're doing all this. So you're doing all of this to curb the blood loss that and it takes place when women are pregnant, especially in their 36th week. You mentioned.
Sure.
Okay.
And also school health services, because of the COVID. When we are going for school health services, people perceive we are going to give COVID vaccine. You can't do these things if mothers have not been informed. So they should allow us to do our duties towards them. Okay. That is all my plea this morning.
More education on this, I believe, at the third conference coming up on the 11th to the 13th of August 2021. Now, remember that it's a conference on maternal, child health, and nutrition. This is the third one, and just like Margareta has mentioned this morning, there are still a lot of gaps to be filled, but hopefully with this third one we'll make a headway. So I'm sure by the time we are done with the fourth and fifth, our numbers would decrease. We'd have a lot more
and
women.
we'll have a more resilient health system.
Fantastic. That's the dream. That's the Ghanaian dream, and I hope that we get there. Thank you so much for coming. Margareta Gloria Chandi, she is with the Ghana West Municipal Directorate of the Ghana Health Service. Thank you so much for coming.